To Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
All right, good morning. Welcome back to Insurance Matchmaking. As I mentioned last week, we are in the middle of the dual enrollment season. Since I spoke to you last, the Senate did vote to open the government, and it'll be later sometime today as I'm recording that the House is supposed to vote on it and then send it to the President for signature for the continuing resolution. They did not approve extension of the tax credits, the enhanced tax credits. And I think the confusion is more for those that maybe hadn't been on the marketplace until, the last year or two. Those that have been on it since, like 2014 or, any time before 2020, they're used to what the subsidies were. Now, what's interesting is I actually met with somebody this week, or maybe I say this week, it might have been last week now that I think about it, but in the last few days that had a bronze plan, and the premium was around $400. I can't remember if that's the right amount, but when we put in her information and the tax credits were computed, she was actually able to get the bronze plan for $0. So not everybody's premium is going up. And as I was saying, some of the confusion is a lot of people think that the subsidies are going away, and that's just not the case. And one of the things that really frustrates me when politicians get out there and millions of people are going to lose their health insurance. The only reason anybody's going to lose health insurance or not have health insurance through the healthcare marketplace is they elect not to pay for their insurance. No one's taking their insurance away. Now, the decisions they're making may make their insurance more expensive, but it's their choice at that point whether they have insurance or not. It's not a matter of it's being taken away. Now, and I've said this several times, and it's getting real interesting, is those in the upper income level that were qualifying for a sizable subsidy, they're fine. I mean, I worked with one couple this week, and basically, and it seems to be, and this is not hard and fast number, but it's gonna apply to most people. That 400% cap, if you're just under that cap, you still have a sizable subsidy. And that was the thing with this couple I was meeting with, that it was going to be, I swear it was like, I don't know, maybe it was $1,200 was the subsidy. In the plan it was more, it was like $2,200. But the plans, gold plans are so expensive that even with the subsidy, yes, it was still going to be like $600, but they were getting a great subsidy. And of course, and then the bronze plan was, $400 to $500 less. I've actually been recommending a lot of people, especially when they're on that upper end, a silver's not going to be a great option. You're not getting the cost sharing reduction, which helps lower the deductible and the copays. That works great for people in the lower half of that 400%, because if you're below 250% of the poverty level, then you're eligible for the cost-sharing reduction on a silver. The thing is, if you're around 200%, you're actually still probably better off going with the bronze or even spending a little bit more and getting the gold, because your deductible is going to be probably lower with the gold at that point. But this year, I'm looking at most of the gold plans. That deductible is $2,000. That $2,000 deductible, you're not going to meet that going to the doctor a couple times a year. And then you have copays we have what we call the expanded bronze plans. Pretty much every carrier has one. And you're going to have a copay for a doctor, copay for a specialist, copay for generic prescriptions. You may have to meet a deductible before it'll cover a brand name. So that could be a consideration when you're considering a silver or a gold plan versus the bronze. But yes, the copays, can be $40 more for a meeting with a specialist. So the difference in copay between the bronze, silver, and gold, it can be, range from $10 to $40 difference. And I'm using that as an example. One of the plans on the bronze, if you see a specialist like a cardiologist or urologist or dermatologist, it's $100 copay. And that's a little steep, but it's still $60 on the gold plan. But I always tell people, well, think about it this way. If you're paying $400 more a month for your health plan, and you're not going to go to that specialist every month, maybe every 3 months. So if you go with that $400 a month more that you're paying for the plan, you're not saving $40. You're spending an extra $1,200 for that doctor. So it really doesn't make a lot of math sense. And I can show you how it works. I'd love to sit down with people and show. I have been recommending a plan. It's actually, and I'm going to be specific on the plan at this point. Allstate Health, and a lot of people don't realize Allstate is a health insurance company. Also, I am not appointed to do Allstate for home and auto. Carrie Hunt's my agent, takes care of that. But Allstate bought National General, which dealt in short-term and supplemental plans like dental, accident, cancer plans, things like that. So we write a lot of those plans. We write a lot of their short-term plans, which is another alternative. But they have a plan that's called TrioMed, and it is a combination critical illness and accident plan. And there's like 5 different levels to it. The one that I like best is it's $10,000. It'll pay out $10,000 for critical illness, or it'll pay up to $10,000 to cover an accident. And the way it works, it takes that accident bill. It has a $250 deductible from what the bill is. It has nothing to do with what your deductible is. So it may cover your deductible depending on the amount on your plan, but it'll pay for that instance. So you don't have to worry about having that money to meet your deductible. Now, you're going to get the bill, but you just submit the bill, and then you get reimbursed. The plan I've been showing a couple people, I quoted 2 different people, and I think it's just because they're close to the same age. It was like $52.67 to have a plan that will pay $10,000 if you end up in the hospital for something like heart attack or stroke. It'll also pay out if you get cancer, because you're going to have a bunch of bills coming from that. And then again, if you have an accident, and when I say accident, a lot of people think, car wreck. Well, and that's one way you can have an accident. But a lot of times if you're in an accident as a result of a car wreck, your car insurance or the person who hits you, car insurance, will take care of your medical bills. But we say accident. It's probably a better name for the plan is an injury plan. Because if you're injured, that's an accident. It was icy this week, so imagine probably there was people who slipped and banged their head and sprained their ankles or broke their wrist, and that's where that plan would come into play and help pay for some of those costs. And then we have other accident plans that will pay just so much, hey, like I said, you sprained your wrist, you went to the urgent care to get it x-rayed, they put a cast on it, and you paid a copay there. And then you file that bill in and say it can be from $250 to $1,000 just because you had that accident, depending on what level of coverage you got. So there's a lot of plans that will fill those gaps. And a lot of people say, well, I don't want to spend more money. Well, the thing is, if you're insisting on getting a silver or gold plan, you're already spending more money. My goal is to make sure you're covered. And I tell people this all the time. And I think I mentioned this maybe last week even. I used to sell cars. And people thought, oh, you're selling that big pickup truck or that fancy SUV. I bet you make a lot of money on those. No, I made a lot more money selling the compact cars. So, and like I said, I'm not going to go brand on this one here, but on the radio right now, because I'm not going to plug anybody. They're not paying me to do it. But it's the same way with the health insurance plans. If you get a health care marketplace plan, ACA, Affordable Care Act marketplace plan is what I was trying to say there. It doesn't matter if you're paying $0 on a bronze plan or you're paying $1,800 on a gold plan. They're still going to pay me the same, somewhere around $20 to $25 each month for you doing that plan. I don't make my living off of just putting people on ACA plans. I mean, it helps. It all adds up. But I'm not making a killing because you have an expensive health insurance plan. That's really what I'm getting at. I want you to spend as little as possible for your health insurance. Now, yes, I do like to pitch the supplemental plans, but also a lot of times people want to get dental or vision, and the thing is, depending on where their subsidy lands, they can't afford that now, even on a bronze plan. And that's what hurts, is like when you have to take the bronze plan because you just can't afford anything else, and then you can't afford to you can't figure a way out to afford the plan that will help you with that deductible. But if you're looking about, and I use this example, and I think I may have again mentioned this last week. I have a client that's spouse is probably going to have a very serious surgery this year, and it's a $10,000 maximum out of pocket on the bronze, which that surgery is going to hit. They're going to hit that max out of pocket. So there really isn't a reason at that point to go for the gold plan, because when you add up the total premiums, there's only $1,800 difference between the max out of pocket on the gold and the bronze. But you add up the difference of premiums, and it was like over $4,000. I think it was like over $4,500 more in premiums. So lowering the deductible is not going to really help you as much as you think it might be. And it's definitely not if you're spending $400 a month more to get your insurance. You're paying the deductible, and that's what all you're doing. And you've probably heard me use this phrase. When you get a silver or gold plan, the main difference between those plans and the bronze is you're buying down the deductible. The structure of the plans are very, very similar. About the only difference I think I've seen between a bronze, and it even applies though on some silvers, is you may have to have a deductible on brand name drugs. Some plans do, some don't. But generally, all plans, silver and gold, you don't have a deductible. But there are plans that have a separate drug deductible. Now, that all goes towards your maximum out of pocket on a marketplace plan, but they don't. But you can have there's plans out there that have a zero deductible for health care, and you just have a copay for everything. And some of those copays can be really high. There's one I was looking at it was like $2,000 for emergency room, and it's $3,000 per day for a hospital stay. But that will put you, you'll hit your maximum amount of pocket pretty quick if you're in there for a couple days. And again, like I said, a surgery is also going to be a big copay. So you're probably going to hit that max out of pocket if you have those serious events. But the nice thing is with the zero deductible, you don't have, if you have to get an MRI, you're going to pay a big copay, but you don't have to come up necessarily with the 100% of the cost because you haven't met the deductible yet. So there's some things there where those plans can kind of help, but sometimes plans like that will have an additional they won't have a health deductible, but they'll have a deductible for certain prescriptions. Like I said, it doesn't usually apply to what we call Tier 1 or Tier 2 generic drugs, but it will apply to a brand name or a specialty drug. So some of those cases will come into play. The other is some people have to get like infusions or something like that. Those can be expensive, and that's where sometimes a plan that's just a copay on that, because the copay does go towards the max out of pocket. It doesn't go towards a deductible. So even though you have a low deductible like on a gold plan, paying a $60 copay to go to the doctor is not going towards that $2,000. You still have the $2,000 deductible. So we're coming up on the break here. I know I've been kind of harping on this. Like I said, pick my brain. I don't mind sharing, and I can show you, put it down on paper and show you why I'm saying I think this is a better option for you.
Join Upper Cumberland Habitat for Humanity as they celebrate 30 years of homes, hope, and habitat. It's the Remix and Mingle November 10th at the Upper Cumberland Habitat Restore, 560 South Jefferson in Cookeville from 5 to 7. Bring the kids out for balloon art, face painting, snacks, entertainment, and more. Tickets are just $10, and that goes right back to the Upper Cumberland community to continue helping families build affordable housing. The Remix and Mingle celebrating 30 years of Upper Cumberland Habitat, November 10th at the Habitat Restore, 5 to 7 p.m.
Hi, this is James Green, your local Twin Lakes security sales consultant. During the busy holiday season, it's easy to get caught up in shopping, traveling, but don't forget about what matters most, keeping your home safe. With Twin Lakes Security, you can enjoy peace of mind knowing your system is always working in the background. Control your lights, arm your system, and even greet guests right from your phone. Call 931-528-2005 or visit us at twinlakes.net to learn more.
Twin Lakes Security, TN-CERT C-0026.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, we're back on Insurance Matchmaking, and before the break, I was harping on a lot about the difference between why you should go with a bronze plan instead of a gold and supplement it with something else. Kind of switch gears here a little bit and talk about what's going on in the Medicare world, because as I mentioned in the beginning, this is the dual enrollment season, so getting piled up. I've got a lot of folks that are reaching out to me and asking me, well, do I just keep my plan? And we tell them, okay, especially when Amy's doing a great job, people call in and say, hey, I need to send you this link. You need to fill out this form. And I have to do this every year. It doesn't matter how long we've been working together. CMS, the Centers for Medicare and Medicaid Services, say that I have to have what's called a scope of appointment before I can discuss your Part D prescription drugs or your Medicare Advantage, which also includes your prescription drugs. It's a real simple form. It's a link. We can text it to you. We can email it to you. We've had some people say, I just can't do that. And we say, well, you can come by the office and pick up the form and fill it out. And because the other part is, especially on the Part D prescriptions, we need your current list of prescriptions, and so it's real easy to fill it out on there. All you have to do is spell the first. Once you get to it says pick your pharmacy, and one of the things I've run into sometimes you use a local pharmacy and the database just doesn't have that local pharmacy in there. If you run into that, just go ahead and put Kroger, Walgreens, what would maybe be your second choice. And then there is a comment section on when you're filling it out. So you could say, I picked Walgreens, but I go to Joe's Pharmacy in whatever town. And we, a lot of times the database we use to check what's the right plan for you, whether that plan's in network with that pharmacy. It usually is there, but some reason on the Retire Flow form, sometimes it doesn't have some of those local independent pharmacies. So if you fill that out, and one of the reasons I like to have people do the Retire Flow is all you have to do is type the first few letters of the drug that you're prescribed, and it'll pop up with options to pick. The only thing is, and I've ran into some people are still doing it, don't just look at the name, look at what the dosage is or how it's administered. Because if you're taking a tablet and it says you take a 1 milligram solution, it's not going to come up with the right drug. And a lot of times it'll come up and say, well, that's not on the formulary and it costs $15,000. And I know you've been taking this drug because it was on your list, So it's very important, very, very important. The other thing is if there's gives you an option for tablet or capsule. It's very important that you pick which one you have because some of them, again, the insurance carrier will cover the tablet and they won't cover the capsule. If you're taking a brand name drug, go ahead and list the brand name. I have found a few carriers that actually it costs less to take the brand name than the generic if it has a generic. A lot of times they don't. Or if you can't, and sometimes the system won't let us put in the name of the generic, but it'll let us put in the name of the brand name. And a lot of times we put in the brand name one and then it says, do you want to switch to the generic? And there's the name, but it won't let us search by it. So that helps us out a lot because we can get all that stuff put in and hopefully have that stuff before we have an appointment or before I can just get back to you and say, hey, I looked it over and yeah, just keep the drug plan you have, or if you're happy with your Advantage plan, we don't have to change it. Now, the beauty there is, again, I've stressed this. If you think you maybe need to change your drug plan, we do have to do that before December 7th. Or you'll have the same plan next year, and you'll have it for a year. There's no special time to get out of a drug plan. Medicare Advantage, we do have an option on that. The first quarter of the year, January through March, you could still change your Advantage plan. So if you're happy with your plan, it's not crucial to get that checked right now. In fact, if you're not unhappy with your Advantage plan, I would rather wait and talk to you in January about it just to see, because sometimes what'll happen is you get ready to go to the doctor in January and February, and they say, oh, we're not taking your plan anymore. Now, most of the providers are usually pretty good about sending out a letter and saying, hey, in January, we're not going to take this plan anymore, but some people do get surprised. Or the other thing is maybe you just signed up for a plan here during the annual election period, and we looked up, and it says the doctor is in network, because the only thing it's going to tell us there is the doctor is in network now. It won't, because the doctors aren't tied to the network like the insurance companies are to their plans. Once they offer a plan, they have to offer that plan all year long. And I'm going to segue that to another subject here in just a bit. But the doctors can leave the network anytime during the year, the insurance company can cut them out of their network. Maybe they think they've been doing wrong or put so many errors on their, or getting a lot of complaints on the billing or complaints from their patients, and the insurance company can just say, we've got too many complaints. We're not going to have you on our network anymore. And one of the things that hurts, it actually hurts the insurance company sometimes, that they'll get a complaint, or the complaint's on the doctor, and it'll get filed as part of, complaint on their plan. And so that affects their star rating. So they want you to be happy with your doctor, so you're not complaining. And they want to make sure that, so they're working with doctors that their patients stay happy with that doctor. But we can change your Medicare Advantage plan anytime in the first 3 months of the year. We can do that one time. So it's not crucial to make sure you're on the right Advantage plan unless you really have been having issues with your Advantage plan this year. The other thing I do want to point out, I've mentioned this once before, and almost every Medicare Advantage plan out there now has a deductible on your prescription drugs. The not the Affordable Care Act, the Inflation Reduction Act, when it put the hard cap on prescription costs, it passed a lot more of those costs to the insurance companies. So they're having to rearrange a lot of things to figure out how they can still afford to cover your plan, to cover your prescriptions. So almost every drug plan out there has a deductible, even the very expensive ones. Some of them still have. Now, the deductible may not be that max $615 that they can put on it when they're charging you a high premium. But sometimes those higher premium drug plans still can be a better option for you in the long run because of the way they treat your drugs, and you get credit with hitting that $2,100 cap without hitting it, and you also have you may not have the deductible or as high a deductible because you're paying it. You're basically prepaying the deductible in your premium. The other thing on that, though, and as I mentioned, in pretty much every Advantage plan now is going to have a deductible. Now, most of them, it's going to be low. It's going to be, $200, $250, but some of them still will go up to over $600 to $615. And they'll exclude tiers 1 and 2. So when we say it excludes, it means you don't have to worry about a deductible if you have a tier 1 or 2 generic. You'll just pay whatever the copay is for that, and a lot of times that copay is zero, depending on if it's a tier 1 and what pharmacy you go to. So that's one of the things we help you look for. And then there are, and I don't know if it's just one carrier that's doing it, but there are some plans that the deductible doesn't apply to tier 3. So that really helps people who are on things like Ozempic or Trulicity, Mounjaro, those different GLP drugs that are about $1,000 a month is the cost on them. So you're going to have to pay that $600 deductible before you start paying a high copay on those. And sometimes that copay is a percentage, that you're still paying about $100 a month for it. So they're going to be very expensive. And of course, if you're spending that much, you'll generally hit that max out of pocket sometime in the middle of the year, but it's still going to be painful during the year. But you can do, and I've been encouraging a lot of people, contact the insurance carrier and say, hey, I want to sign up for the monthly payment plan. And what they do on that, the prescription payment plan, they will take whatever it is. So they'll add in your deductible and the cost of the drug and everything, and then they'll divide that by 12 and say that's your bill. The great news there is you won't pay anything at the pharmacy, but you are going to be paying another bill monthly for your prescriptions, but it's going to not be, max it's going to be is about $170 because it's $2,100 divided by 12. So it's not going to be a big payment, but you still will have that monthly payment. One of the things, and I mentioned the insurance companies are really throwing a monkey wrench in the gears here on us when it comes to signing people up for a Part D prescription drug plan. There's currently only 2 drug plans now that I can sign somebody up for on you've maybe heard me talk about our tool called Sunfire. And if you've worked with me, you've gotten emails from Sunfire showing, quotes for your plan, or I email you a copy of the application once we've completed it. Sunfire is great for my quoting everybody's plans because I can look at everybody's plans. I say everybody, I'm talking about all the carriers' plans and say, oh, if you're going to be taking this prescription, you probably don't want this plan because it's not on their formulary, and that doesn't count towards the 2100 max. And then the other is, oh, nope, your company's good. You're still covering all your drugs. They're all tier 2 or, 1 or 2. You're not going to have hardly any costs at all. Or, hey, you got this one tier 3, but it's tier 3 on everybody, so you're still better off staying where you're at, but you are going to have to come up with the full cost of it, or at least up to the deductible that first time you fill it, and then it's going to be a $40, $50 copay every month. Or, like I said, mentioned just before, could be $100, but it was not going to be $600. But anyway, the companies, because of what's happened with the Inflation Reduction Act making all these changes, a lot of these plans are going to non-commissionable, or they want to make it harder for you, not just for me to do it for you, but for you to sign up on their plan. So it's like you have to go to Medicare.gov and sort the plans or sign up there, or you have to call the 800 number of the company. But I can't just do it for you in this one tool. And the one of the plans that's still there is, and it's still a good plan for a lot of folks, but it's a plan that went up $50. And for a lot of people, they took the plan last year because it was a bargain, and now it's one of the more expensive plans. So some people are wanting to switch their plans, but the insurance companies have made it harder for us to switch your plan. Now, there is currently, the latest count I saw was there were 6 states that the departments of insurance of those states have filed against the insurance companies, telling them that they cannot make it harder for us to sign them up. They can't issue a plan and then turn around and make it non-commissionable, because that's causing us to steer you, away from their plans, which is their goal, but they're getting involved in steering, which is illegal, and it forces us kind of like, hey, I don't want to show you these plans because this plan may be a good plan for you, but I can't get paid for that. So it's not, it's hard for me to justify my time if I'm moving everybody to a plan I can't earn commission on. That's how I live. I earn commission. Doesn't cost you to work with me, but I do get paid a commission, and that's built into whatever the cost is for the plan, so it doesn't raise your cost. So those are some of the things that we want to make sure that you know, and that's why. And if you one of my clients and you sent me information I haven't got back with you yet, is I'm having to prioritize. I got a bunch of forms coming in with the information, and if that person is coming in tomorrow on an appointment, I have to make sure I get that done first, because I am going to meet face to face with that person. We still have time. I want to try to get everything done in October, so I wasn't doing it during the annual enrollment or the open enrollment period for the ACA plans. Was get those reviews done quick and then be done with them. So now I'm getting a little behind, because in pretty much every day, in fact, I talked to someone this morning, and they're like, I think if we can come in on Friday, or do we need a phone for an appointment? I said, yes, definitely phone for an appointment. I said, unless you just want to sit there and wait until I'm done with whoever's already there. And they're like, oh, no, don't want to do that. So yes, call and make an appointment. I do have Elijah in the office. Kalia is working some hours in the office, and then Bree is still available too. She's working part-time as an agent and working full-time at another job, but she is available in the evenings and weekends to run appointments. So we can get you taken care of. It's just you may have to wait. It may not be today. And then again, today there might be some time today. And that's the thing. Always call, because we get cancellations. That happened yesterday. I had a cancellation yesterday. So I had some time available early in the day that I got some other things done during that time. But, if I had to, I could have ran an appointment at that time. So call if you think you need, extra time. So it looks like I'm out of time. So until next week, stay tuned to Grace 107.7 and check out insurancematchmaking.com to go to the YouTubes of my previous shows. Please subscribe to my channel. Helps me get the word out. And we'll talk to you next week.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.